Hello all, we have our last section here of these slides. So nonlinear pharmacokinetics, recognizing nonlinearities and evaluating. I think by now you're probably in pretty good shape on how to recognize and evaluate nonlinearities. So compare what is observed to what you would expect for a linear relationship. So you always expect a linear relationship, and then do the math. It's a proportion usually between dose rate and CSS average, or dose and area of the curve, and see if they are changing, or if clearance is changing with concentration, or bioavailability, or half-life. If any of those are changing with concentration, then something is up. Determine which kinetic parameter may explain that alteration in which direction. So what could be causing this? That's what I want you to be able to do. So compare what is observed to what is expected. Well, we did all this, all right. Oh, okay, I see. Okay, so if K is increasing with time, then K should be consistent, right? So what's happening? If K is increasing, that means that K is, oopsie. I'm going to change it. K is equal to clearance over volume. These two should not change with time. They should not change with dose. They should be consistent, unless there's one of the parameters that cause a change to cause a change. But if it's increasing consistently with time, that either means that clearance is increasing, nonlinear in clearance, with it increasing with time, or a decrease in volume with time. So that's what we did. We figured out what determines K, and therefore what could be causing this. So what could cause an increase in clearance? This is backward. Clearance could be increasing with time, so that means that for some reason clearance is increasing. That could be saturable fraction unbound. Could be saturable plasma protein binding for a low extraction drug cleared by the liver. Volume decreasing with time, that could be saturable fraction unbound in tissue. If the fraction unbound in tissue is increasing, remember that's in the denominator, that's going to cause a decrease in volume of distribution. So this slide is incorrect. Yikes. Okay. What if we see an increase in fraction unbound with increasing concentration? Well, I don't know what this is. I'm going to just pass this up. Consequences of nonlinearity. If the bioavailability, which is probably going to be a change in FH, is changing, then obviously that's going to affect anything that's given orally or by a first pass route. So we can have nonlinearities and bioavailability. What will happen to FH is when those enzymes get overwhelmed, we're going to see an increase in FH, therefore an increase in bioavailability. So it's just going to be like giving more drug. We'll see an increase in CSS average, an increase in area under the curve if we're looking at that. So nonlinear bioavailability would result in increases in CSS average, increases in area under the curve. No change in half-life though, right? What about changes in metabolism? What's going to happen here? So this is going to increase. This is going to decrease. As those enzymes get overwhelmed, you're going to see a decrease in intrinsic clearance, which will result in a decrease in hepatic clearance for a low extraction drug, which would also increase CSS average or area under the curve for that low extraction drug. How about renal clearance? If you overwhelm these tubular secretion sites, what's going to happen? Well, if you overwhelm those tubular secretion sites, more of the drug is going to stay in the blood. It's not going to get moved to the urine. Therefore, you're going to see a decrease in renal clearance, aren't you? If you see a decrease in renal clearance, you'll also see an increase in CSS average. If you have binding fraction unbound in plasma that is nonlinear, you're overwhelming those plasma protein binding sites, you're going to see an increase in the fraction unbound, aren't you? So you would see an increase in clearance for a low E drug that is cleared by the liver because it's dependent upon the fraction that is free. You would also see an increase in glomerular filtration clearance in the kidney, wouldn't you? You're also going to see an increase in volume distribution. If for a low extraction drug, you're going to end up seeing no change in half-life, but because both of these are increasing. There you go. So, lots to think about. Thank you.